Hello, hi everyone. I'm your host, Dr. R-jalal, with a new video. This video is very important. It is about a very important topic, which is essential communication and interpersonal skills for PLAB 2. This video is part of a series of videos, and in these videos, I will be discussing all the important scenarios which as a PLAB 2 student you can come across in your exam. So please watch all these videos and listen these and watch these carefully and practice these with your colleagues, and hopefully you will find these very useful for your exam preparation. This is part one of this series, and in this series I have selected a few initial scenarios which we should know about for our PLAB 2 exams. So let's go to our presentation. First of all, we should know that what are interpersonal skills and why are these important. Remember that being a good doctor doesn't mean being the most brilliant doctor or having a lot of medical knowledge. A physician's interpersonal skills can improve patient health outcomes. When doctors and patients are able to engage in effective and meaningful communication, patients feel empowered to participate more in their care, which leads to better and faster recoveries. Interpersonal skills reflect a person's emotional intelligence rather than just their academic knowledge. Some of the key interpersonal skills are building good rapport and trust with your patient, being an attentive listener, and knowing how to communicate effectively, and the ability to explore what is in your patient's mind, and the ability to reflect back on what your patient is telling you. And you should be able to pick up the issues and how to solve the problems of your patient. Another important interpersonal skill is the ability to motivate your patient. And the most valuable of all interpersonal skills is showing empathy to your patient. Empathy allows for doctors to better understand and relate to their patients. Communication skills are critical for understanding patients' actual issues, motivating them to engage in their healthcare, and delivering the most effective treatment possible. So this is the importance of interpersonal skills and why doctors should have these skills. A doctor with good interpersonal skills and communication skills can actually achieve better clinical results. Let's start our first part of interpersonal skills. This is how to start a consultation. Remember grips. You need to start your consultation with grips. What is grips? So I will go into the detail of grips, but the main purpose is that you should be able to make sure your patient likes you and have trust on you. So coming to grips, G stands for greetings. You have to greet your patient in a nice way, according to the situation. You should say good morning or good afternoon. But remember, you shouldn't say good morning or good afternoon when patient is in distress or when you are breaking bad news, right? In these cases, you just need to say hello and then R for rapport. In grips, there is nothing much rapport, but at least you should maintain good eye contact. You should attain a friendly and attentive manner. Be aware of your posture, gestures, tone of voice, and don't forget to check your patient's comfort. You need to check whether the patient is in distress or pain, and you have to respond accordingly. Next step is introducing yourself and identify your patient. Check identity. Politely introduce yourself. I am doctor, and then give your surname. A junior doctor in this department. or in this GP practice. And then establish patient's identity. May I ask your name, please? Can I confirm your age, please? Or are you, and then take name of the patient. You can ask, are you mother of, if she is going to discuss something about her child. And you can ask, are you wife of, or you husband of, if someone is going to talk about their spouse. It is better to ask that, how may I call you? Because mostly people like to be called with their surnames. And P stands for purpose of the consultation and privacy. You have to explain these things to patient. You can explain to the patient why we are here. For example, for follow-up, for review, for discussion of test results, right? And then you have to explain to the patient that I will ensure your privacy. And S stands for social courtesy. What is social courtesy? You have to be kind, you have to be nice, polite, very humble, and respectful by your expressions, gesture, tone of voice, choice of words. This is social courtesy. Take permission. Can I proceed? Can I start asking questions? And then appropriately use, please, can you tell me this? Can you explain to me this? Can you share this with me? And then you can say thank you. And if you made any mistake, you can say sorry. Whenever asking questions, say, please, can you tell me? Would you tell me? And don't forget to appreciate the patient for good things. For example, you can say, it's good that you have come for medical attention, or it's good that you have sorted medical attention. After finishing history, you should also say thank you. Thank you, Mrs. X, for all the information, for your patience, for your cooperation. So this is also part of social courtesy. Next step comes how to start history taking. Remember, history taking should start from opening questions. There are some suitable phrases. How can I help you today? Mrs. X, what brings you in today? Mrs. Smith, what can I do for you today? Is there anything I can do for you today? Patient says, doctor, I have pain, or I have headache, or I have tummy pain. Then you should say, could you please tell me more? How or when did it start? Don't say, I am sorry in every case. I'm sorry to hear this. I am sorry to hear that. You don't need to use these in every case. However, if patient says, doctor, I have severe pain, or I have severe headache, then it is better to show empathy and care before taking history. I am sorry to hear that. Are you comfortable to talk to me? Should I give you a painkiller first? I can see you are distressed. I can see you are upset by your pain. Do you want me to give you some painkiller before we start taking history or we start talking? It must be difficult for you to cope with this. Is it okay if I ask a few necessary questions? Then I will give you a very good painkiller to control your pain. Is that okay, Mrs. X? You can say, I am sorry that you have been feeling this way. Please don't worry. You are in good hands. We will try our best to help you and manage your pain. And then explore pain fully by Socrates. Another important point in interpersonal skills is that your consultation with your patient should be two-way. You should involve your patient in consultation. During the consultation, keep asking, is it okay? How does it sound? Is it all right, Mrs. Smith? Do you have any opinion on this? What do you say, Mr. John? Does it make any sense? Are you following me? Are you with me so far? Do you have any questions up till now? And then you need to build your rapport step by step so that your patient likes you and trusts you. How can you build your rapport further? By reflecting back on what patient is telling you. If patient says, doctor, I am pregnant, or patient says, I am newly married, you should say, congratulations. This must be very exciting for you. Doctor, I am an accountant. I am an office worker. I am a builder. Reflect back on it by saying, do you like your job? How's your work day like? Do you enjoy it? Is there any stress at the workplace? Is this disease affecting your work at all? Keep reflecting on different things throughout your consultation. For example, patient says, doctor, I went on vacation. Ask, where did you travel to? Was that exciting? Did everything go well? Did you enjoy it? If a patient is being discharged from hospital and you are there to discuss something, then say, I am glad that you are going home today. Do you have any questions regarding the instructions or medications? So try to involve with your patient emotionally. Then sometimes a patient may be finding it difficult to open the consultation. Patient may be embarrassed because of something. In such patients, say, I can see you are embarrassed. Don't worry, I am here to help you. I can see that this is clearly difficult for you to talk about, but there is no rush. Please take your time. And thank you for coming to the hospital or clinic to discuss this. I know it can't have been easy. Encourage the patient. And then if patient says something, tell you about his or her problem, then say what you are talking about is something that is very common. You are not you are certainly not alone. If you prefer, I could ask if a female doctor see you if patient is still uncomfortable, or a male doctor if the patient is a male and you are a female doctor. You can ask if it makes it any easier. Remember that anything you say is confidential unless safety issues for you or others arise. Offer confidentiality. Sometimes you need to offer confidentiality. Otherwise, patient will not discuss anything with you. Sometimes you see a patient who looks worried or anxious. You cannot ignore these cues. You have to reflect on these. You have to show empathy and care. I can see you are anxious. Would you like to share with me why you are feeling this way? I can see you are worried. I can see you are concerned. Can you please tell me why you are worried? Please don't worry. We are here to help you. May I ask, what are you worried about? Please let us know. We will try our best to help you out. Sometimes patients are anxious about their test results or for going for investigations or tests. Reflect on this. It is perfectly normal to worry or be anxious about going through all these tests. But we do several of these tests every day because your test will give a lot of valuable information which allows us to make the best treatment plan for you. Tell the patient that it could all be well, nothing to worry about. The result could all be normal. And if there is something wrong, even if your test result becomes positive, don't you think it is better to find things earlier so that we can give you treatment at the beginning? If patient says that, doctor, my health has affected my life, you cannot ignore this expression. What should be your response? I am sorry you are going through a difficult time. You must be feeling very sad. I wish you didn't have to go through all this. Do you have any family support or close friends to be with you at this time? So show empathy, show that you are a caring doctor. This will all help you a lot, believe me, a lot, to build up a good rapport with your patient. Another important thing in history taking is exploring ICE. What is ICE? ICE stands for ideas, concerns, and expectations. ICE help you to know what is in your patient's mind. It is not only the physical symptoms which you need to know about your patient. What is in their mind? What are their ideas, their fears, their concerns, their expectations? You need to ask, do you have any idea what might be causing your problem? Mrs. Smith, what do you think might be going on? Are you particularly worried about something? Do you have any questions in your mind? Do you need any clarification at this point? Is there anything you may have thought we could do for you today? What are you hoping from today's visit or today's consultation? What are you expecting from us today? Do you have any idea about what should we do to help you better? So ask what patient is expecting from you. It's not just that patient has come for a diagnosis or for tablets or some prescription medications. And sometimes when you explain things to your patient cannot understand. Patient says, doctor, I am totally confused about what you are telling me. Don't get angry or annoyed. These are the interpersonal skills. How would you respond? I am sorry if I wasn't clear. My apologies if I confused you. Is there anything in particular you want me to explain more? Is there anything specific you want me to clarify? Do you want me to clarify anything in particular? So this is how you make a connection with your patient. Another patient says, Doctor, I am not happy. I am not satisfied about the care. What will you say? I am really sorry. I apologize you feel this way. Can you tell me a little more about it, please, so that I can do best for you? Mrs. X, was there something that happened during the care which is making you unhappy or dissatisfied? Try to find out details and ask, is there anything which I can do to rectify this? And dear viewers, this is end of part 1. Thank you for watching this video, and don't forget to watch remaining parts of my IPS videos. These are very important for those who are preparing for PLAB 2. Please keep watching these again and again until you pass your exam. And please subscribe to my channel, and don't forget to press the bell icon for more interesting videos. Thank you very much, and see you again with other parts of these videos. See you and bye-bye.